So now about another fourth one here we are talking about, that is spinal stenosis, right? What is stenosis particularly? Spinal stenosis. This is totally different. Again we are talking about the spine, but this is nothing related to the disc. It's related to the area where the spinal cord is placed. So this is the vertebra. This is how the vertebra is arranged. All the vertebral structures are arranged like this. So it's creating a channel like a pipe, you know, and through the pipe there is the main wiring, that is the central nervous system. The spinal cord moves in, and through in between those different vertebra there are nerves coming out. And in stenosis what happens, if this is the diameter, for example, this is the diameter through which the spine is placed, the diameter gets reduced and gets smaller and smaller. So if the diameter gets smaller, then what will happen? Stenosis means getting smaller in that side. So once that part gets smaller, it creates pressure in the spinal cord. Although there is a little extra room, and there is also a protective fluid, CSF, present there. But still, if the stenosis start to occur, there is a immense pressure on the fluid, CSF, and also pressure on the spine, pressure on the spinal nerves, spinal cord, and as a result to that it can cause pain. And not only pain, generally what happens in stenosis, there are three kinds of stenosis that is possible. The stenosis can happen in your cervical spine, this area, right, this area, we call it cervical spiral stenosis. It can happen in the thoracic spine, thoracic spinal stenosis, or the lumbar spine, lumbar stenosis. Okay. Now what is the cause of this stenosis? It's actually really difficult to tell, because generally the patients that we take, the patients that we actually follow having stenosis, we don't find a proper answer to that, because they didn't know when it started. When the patient visits us with stenosis, we simply see that the stenosis is already fully formed. Okay. Very rare that the whole vertebra have a stenosis, except for any trauma or injury. Normally there is a stenosis of the lumbar spine, or sometimes in the cervical spine. So there is no proper symptoms when it begins, because there is an extra room, as I mentioned earlier. But the stenosis, when it increases, so the deposit increasing and the diameter is decreasing, at that moment the patient may feel pain, numbness, weakness. And what happens is that sometimes, you know, the person sitting for long hours, the person may complain that I cannot move my legs. All of a sudden this kind of effect, then again it will go back to normal after some time, because the nerves that are moving and providing the information, impulse to different location of the body, they stop suddenly because of the pressure. I mean, their function is hampered, and that's why this kind of issues. So many people may ask, like, we have chronic like lumbar stenosis, so is there any chance of future paralytic activity? We can say, yeah, there is a chance of future paralysis to the leg, any one side, left side, right side, or sometimes both side. So that's why stenosis is a serious concern. Once it's diagnosed, first of all it will be diagnosed very later stage. So whenever it will be diagnosed, you need to go for a CT scan, and best is MRI. Go for an MRI, get the total details of the disease, because X-ray is not going to do anything in stenosis. Don't prescribe X-ray for a suspecting stenosis. Okay, because if a person with stenosis, there is no bulge out structure, there is no inflammation outside. So whatever problem is there in inside, and the person will feel fatigue and problem and pain in different locations, either in the lower part of the body, or if it's in the thoracic spine, then there is the back side, this whole upper back area. So in that case, go with the MRI. If the patient cannot afford it, at least CT scan, then continue the treatment. Okay, in stenosis, it's the normal physiotherapy measures, normal physical therapy measures can just manage it, but the effectivity that the physiotherapy can put, the laser therapy can put for herniated disc, degenerative disc disease or arthritis, compared to that, in stenosis it will take more time. Obviously it will give you benefit, but it will take more time for relaxation. And particularly one specific kind of treatment that we are designed, that is old treatment but we still use that is scanar. Scanar is found to be really important, really helpful for the spinal stenosis, because it simply we simply apply small voltages to the nerve. We actually play with the nerve's signal. So if there is any issue with the nerve signal and causing paralysis to the area, we can counteract that signal with a scanar. Artificially will generate a signaling, artificially will generate a fire of the nerves, and as a result of which it may prevent that occasional paralytic tendencies that a person may face with spinal stenosis. That's what we can do. Scanar is found to be really important. Laser therapy will be important, but it will take more time, more sessions. Okay. Other than that, cortisone injections are there, as well as the drug treatment is there. I am not going to talk about that, anti-inflammatory drugs. And finally, surgery. Surgery has a big downtime, and also it takes long time for the patient to get cured totally. So, but without surgery, if you want to talk about, you go with the laser therapy treatments and as well as TENS treatment there. Apart from that, we also go with scanar treatment in this case. Okay, scanar is really good in this kind of situations.